When you get to a value-based model, how does that change behavioral health as a component to total patient care?
I think that there's a way to be successful in a fee-for-service world with behavioral health, but not in a way that drives the kind of population health outcomes that need to happen to decrease overall healthcare spend. When you get to a value-based model and you're really focusing on outcomes versus a fee-for-service, then you work to intervene as early as possible in illness and keep patients out of those high-cost services. And so I think it just flips the model on its head, and behavioral health becomes a very important part of overall health care, not a behavioral health separated from physical health, but integrating those two back together to take care of a whole person in order to meet those targeted outcomes that are in the plan. Say that a patient comes into a practice and they're really in a legitimate crisis. Mm-hmm. This is an appointment that would have taken a primary care provider an hour to 3 hours out of their day to resolve. What happens today in our practices that have integrated services, patient comes in, they're in a legitimate crisis, the provider tells his medical office assistant, get our behavioral health specialist, and they get us and connect us on a video within 3 minutes, and we have a provider in the room with the patient within 3 minutes on a video interface. And then we start the process with the patient inside that primary care appointment. But I can say that within our model, in 1 year, we had a 13% reduction in avoidable ED visits and a 25% reduction in avoidable inpatient hospital stays, and an overall decrease in cost in ambulatory visits in our highest utilization population.
You sound enormously receptive to the idea of taking that risk because
Absolutely.
You're confident you can deliver on
Absolutely.
it more efficiently.
Yeah.
We need a movement in the General Assembly to really tackle two things then. One is the integration together of the reimbursement model, but the other is align reimbursement to outcomes, not to fee for units of work performed.
Exactly.
Yeah.
Exactly.
What portion of that appointment is the psychiatrist gathering information from the patient to get to a point to make a diagnosis?
That's how psychiatrists work.
Right.
They work by gathering information from the patient. So I'm guesstimating, but I would assume 75% of that appointment is that, and then the rest is teaching the patient about their illness and the proposed medication or treatment. Yeah.
So let's imagine that there was a mobile app instrument that was integrated already in the Cerner environment, which you live in.
Right.
And you could use that to trigger interaction with the patient, perhaps before they come in for an appointment, and do all the screening and ask all the questions and gather all the history.
I agree. I think that's the opportunity, is to link what's going on in the mobile world and digital technology world into an EMR to create a unique service around a patient.
Yeah.
Right now, they're pretty disconnected.
The intersection of mission and margin is the business of healthcare.